Hi and welcome. My name is Nisa Elamine, and I am a member of the National Coalition for 100 Black Women, Oakland Bay Area chapter. Thank you so much for tuning in to this important series, Be Your Own Health Advocate. Today I'll be presenting on topic number 3, healthcare maintenance. In general, screening guidelines apply to healthy adults in the general population. This video will highlight recommendations for African American women and will summarize data from multiple professional organizations. Please keep in mind the right plan for your care may differ based on your medical history, family history, personal preferences, and lifestyle recommendations. You and your physician should work together to develop a specific plan for screening. Why is this an important topic in the African American community? Well, first, statistics show that the leading cause of death amongst African American women includes heart disease, cancer, stroke, and diabetes, all of which are preventable with early detection and screening. The COVID-19 pandemic has had numerous consequences secondary to the disease itself, including reduced access to care for other illnesses. Early in this pandemic, there was a need to divert healthcare resources to address a rapidly growing number of individuals ill with COVID-19 and by suspending non-urgent healthcare. Some individuals may continue to delay preventative health and follow-up due to fear of exposure or loss of employer-based healthcare benefits. These ramifications will particularly affect African American communities that are already having challenges accessing quality medical care and face a disproportionate burden of COVID-19 illness, hospitalizations, and death. Let's start with blood pressure screening. High blood pressure increases the risk for heart disease and stroke, two leading causes of death for African American. 44% of African American women have high blood pressure compared to 37.5% of white women. High blood pressure usually has no symptoms, so the only way to know if you have it is to get your blood pressure measured by a healthcare professional. The United States Preventative Task Force recommends annual screening for adults aged 40 years or older and for those who are at increased risk for high blood pressure. African American women are at high risk, therefore should be screened annually. Osteoporosis is a condition in which bones become weak and brittle. Women 65 and older with a normal bone mass should have a bone mineral density test, or BMD test, starting at age 65, and more frequent testing is recommended for women with certain risk factors for osteoporosis, such as smoking, alcoholism, history of a hip fracture in a parent, or rheumatoid arthritis. Breast cancer screening guidelines have changed several times over the past few years, and depending on the professional organization, recommendations may differ. Statistics show that Black women are more likely than white women to be diagnosed with breast cancer before the age of 50. BRCA or BRCA mutations are more common in African American women than in white women, although less frequent than those of Ashkenazi Jewish ancestry. The triple negative subtype of breast cancer is more common in Black women, and this subtype can be aggressive. Because of the higher incidence of aggressive breast cancer at a younger age, Black women may be at a disadvantage by organizations recommending initiation of screening mammograms at age 50. The American College of Obstetricians and Gynecologists, ACOG, and the American Cancer Society recommend annual screening beginning at age 40 without a specific discontinuation age. All women, including African American women, should be assessed for breast cancer risk starting at age 30. Women should get screened annually starting at age 40, and at age 55 can switch to every 2 years if preferred. Like breast cancer screening guidelines, cervical cancer screening guidelines have changed over the years as well. Recently, the American Cancer Society updated their screening guidelines for starting age and frequency of cervical cancer screening tests. The incident and mortality rates of cervical cancer have decreased because of the prevention and screening with the Pap test. A Pap test, often called a Pap smear, looks for abnormal cells that can lead to the cancer in the cervix. An HPV test looks for the human papillomavirus, a virus that can cause cervical cancer. For an HPV Pap co-test, an HPV test and a Pap test are done together. Women should be screened for cervical cancer with Pap tests beginning at the age of 25 years old. Get a primary HPV test every 5 years. And if a primary HPV test is not available in your area, then acceptable options include a co-test, so HPV done at the same time as a Pap test every 5 years, or a Pap test alone every 3 years. Women who have been treated for precancer or cervical dysplasia should continue to have Pap tests for 20 years after treatment or until age 65, whichever is longer. If you have had your uterus or cervix removed, so a total hysterectomy, and you have not been diagnosed with cervical cancer, you do not need to have Pap smears. Cholesterol is a waxy substance that your body needs to make hormones and digest fats. Your body makes all the cholesterol it needs, but you can also get cholesterol from eating certain types of food, such as egg yolks and fatty meats. Having high blood cholesterol can lead to plaque buildup in the arteries, putting women at risk for heart disease and stroke. High blood cholesterol doesn't have symptoms, just like high blood pressure, which is why getting your cholesterol screening is more important. Cholesterol testing should be done every 5 years for people aged 20 years or older who are at low risk for cardiovascular disease, more frequently than every 5 years for people with cardiovascular risk factors. Risk factors include if your family has a history of early heart attacks or heart disease, or if a child has obesity or diabetes. The tragic passing of Black Panther Chadwick Boseman from colon cancer highlights the need for screening earlier in African Americans. According to the studies, African Americans are at higher risk for colorectal cancer compared to other populations. Guidelines recommend currently, starting at age 50, everyone should begin routine screening. Research shows that African Americans are being diagnosed at a younger than average age than other people. Therefore, the experts suggest that African American women should begin their screening at the age of 45. Those between the ages of 18 to 39 should discuss their risk factors with their doctor or nurse practitioner. There are several screening tests available. The fecal occult stool based test can be done every year, as well as the fecal immunochemical test or the FIT test. A stool DNA test can be done every 3 years, and the flexible sigmoidoscopy every 5. Colonoscopy is considered the gold standard of colorectal cancer screening methods for its ability to view the entire colon and both detect and remove polyps during the same procedure. It is the only test that is suitable for individuals who have risk factors such as a family history of colorectal cancer. Colonoscopy should be done every 10 years. Diabetes is a group of metabolic diseases characterized by hyperglycemia or high blood glucose resulting from defects in insulin secretion, insulin action, or both. Uncontrolled diabetes can lead to blindness, limb amputation, kidney failure, and vascular and heart disease. Diabetes screening guidelines differ between the American Diabetes Association and the United States Preventative Task Force. Their guidelines are mostly based on risk factors like high blood pressure, obesity, and high cholesterol. Screening tests for diabetes include hemoglobin A1C, fasting plasma glucose level, and the 2-hour 75-gram oral glucose tolerance test. Screening is listed here on the slide and is recommended for symptomatic patients, adults age 45 and older, adults between the ages of 18 and 44 who are overweight or obese and have one other risk factor for diabetes, adults with prediabetes, and women who have a history of gestational diabetes while pregnant. Sexually transmitted infections include testing for gonorrhea, chlamydia, syphilis, hepatitis C, and HIV. Sexually active women younger than 25 years old should be tested for gonorrhea and chlamydia every year. Women 25 and older who have new or multiple sex partners or a partner who has had an STI should also be tested. That includes important healthcare maintenance screenings for African American women to consider. Please don't forget other important screenings to consider are listed here at the bottom of the slide. Next up is interpreting basic lab values.